Mike, this question's for you. You talk a little bit in this report about what's happened in other countries that have done this. Can you highlight a little bit of that, what's happened in Europe and some of the other areas so that we get a good sense of where we're going with this?
I actually was going to make some comments about that in my presentation, but Carrie had covered it a little bit. There are only a handful of countries in the world that have permitted or enacted, at least that we know about, doctor-prescribed suicide. Switzerland is one, has had in place death by doctor for many years, and you may have read over the years about the problems in Switzerland. They're very much like the problems in Oregon. There's no reporting, and nobody really knows exactly what is happening, who's dying, and for what reason or at whose hands. Of course, I think everybody would identify that maybe one of the sources of physician-assisted suicide was Adolf Hitler in Nazi Germany. Hitler's personal physician was in charge of the Nazis' program called T4 euthanasia program, which was instrumental in euthanizing thousands and thousands of people, mostly people of Jewish faith. I'm sorry, I'm digressing a little bit, but I just finished reading a book called Boys in the Boat, and if any of you have not read the book Boys in the Boat, I encourage you to do so. It's a wonderful story about the Washington crew team competing in the 1936 Olympics in front of Adolf Hitler. Great story. The Netherlands first implemented physician-assisted suicide in 1973 when a Dutch doctor gave her grandmother, 78-year-old mother, who was deaf and partially paralyzed, a lethal injection. We don't know to this day whether or not that mother was one of those people who Carrie Ann has talked about that had no desire to see her life ended at that point in time. The doctor was in fact later convicted of murder. However, the court suspended her sentence, finding her to be, quote, compassionate, close quote. And then Netherlands legalized physician-assisted suicide in 2002. Australia had physician-assisted suicide in its jurisdiction in the Northern Territory areas for a short period of time in 1996, but repealed that. Colombia, the court of the South American country, Colombia, found that Colombia citizens have a constitutional right to euthanasia for those terminally ill patients who request it. Again, the issues of reporting and accountability are non-existent. Belgium, Luxembourg, and Canada are all in the category of doctor-prescribed or assisted suicide, some by legislation, some by court rulings. So that kind of gives you an idea of where we are.
I would add one thing. The idea in terms of eugenics really started in this country, however, and Hitler adopted it, but here in the late 1800s and early 1900s, eugenics was very common. It culminated in a Supreme Court decision called Buck v. Bell, which is still good law, that said where the Supreme Court said, 3 generations of imbeciles is enough, about a woman who was presumed, who actually did not, but was presumed to have an intellectual disability, and her right to have children and forced sterilization. But also you had Harry Halcyon, which is the black stork, who created a 1920s silent movie about his efforts at eugenics and to murder disabled infants. So we have a long history of this in this country as well, which fortunately we had moved away from by the 40s. But it's something that we also should keep in mind, is that we have that background here as well.
And I want to add to Carrie Ann's correct analysis of the history of eugenics in this country, that one of the primary motivating sponsors of eugenics in this country was Margaret Sanger, founder of Planned Parenthood, which still exists as a motivation in Planned Parenthood to this day in minority and black communities.
Let me say one thing about in the Netherlands. Initially, they had assisted suicide and euthanasia legalized, but everyone opts for euthanasia because it's a lot easier. You don't have to swallow the pills. You don't take a chance the patient's going to vomit. You don't take a chance the patient's going to become unconscious and not die. Euthanasia is a lot easier. It's a lot cleaner. And when countries have an option, that's the one that they default to. There was a government study recently that found that 7% of the intentional deaths in the Netherlands are people who were killed and did not ask to die. And that's a very recent statistic. That's thousands of people. They actually have a category for that. Basically death without explicit consent. So that's what's happening in Holland. Once you kind of open that door, this idea of a slippery slope is often poo-pooed, if you will, by proponents of this. But you can't look at what's happening in Belgium and the Netherlands. In Belgium, it's Katie bar the door. Listen to some of these. There was a man that was euthanized after a botched sex change operation. There were two identical twins who were euthanized together because they were going blind, and they were so close they couldn't deal with the fact they might not see each other again. These are the types of cases that doctors will euthanize. They will euthanize disabled infants. This does not stay restricted. This is like putting fire in a paper bag. You cannot contain it. The human nature is too evil to do that. So just look at what's happening in Europe, and you can see why we're such advocates of this not coming here.
All right, questions? Yeah, go ahead. Oh, you may want to turn it on. I don't know if it's turned on, Carrie. Right? So.
I'm confused about whether or not 100 is on the ballot or they are petitioning to get on the ballot. Is there anything as a
At this point, both of these initiatives are before the title board. They are in the process. They have not given, they've not been given the green light to collect signatures yet. It will also be challenged by Carrie Ann's group at the state Supreme Court. So we hope to tie this up in court to the point that they have very little time to collect signatures, but they are not collecting yet that we know of. If they did it right now, and the title board of the Supreme Court changed any of their language, all those signatures would be lost. And they're going to have to buy a lot of them because they don't have a big grassroots like really the pro-family community does.
Let me add to what Carrie has just said there. This is a little bit of a kind of inside baseball technical area, but in order to qualify a citizen initiative for the ballot in the state of Colorado, it's got to go through a process whereby, first of all, it's considered by a legislative council group of the state legislature, then referred to what Carrie referred to as a title setting board. The title setting board is a group made up of a representative of the Attorney General, of the Secretary of State, and of this Legislative Counsel Service. And because the legislature and others have not understood or thought that the citizens of Colorado had the intelligence to make up their own minds on initiatives, the law requires that initiatives, citizen-initiated measures, have to be single subjects, can only be one subject, can't be multiple subjects, and have to have clear and non-deceptive titles. That's the purpose and role of the title setting board. It decides whether there is a single or multiple subject in the proposal, and if there is a single subject, whether the title is clear and not misleading. Now, until the title board rules on that issue in this or other cases, the proponents are not able to obtain signatures for their petition. And so what Carrie is saying, Carrie Ann is doing, is throwing up as much by way of appropriate, reasonable, and legal roadblocks in that process as is humanly possible to keep, first of all, keep them off the ballot if that's at all possible, but to minimize the amount of time that would be available for them to circulate and gain signatures.
Now, proponents are saying that 65% of Coloradans would support these. Where are they getting these numbers?
Well, I think some of it's the language they use in these polls. So they're using euphemisms like medical aid in dying. When I hear medical aid in dying, of course you want medical aid in dying. Who doesn't want to help somebody who's dying? You think pain medication, you think palliative care, you think hospice. They're using this type of language when they're polling people. So we'd like to see, we know when the Pew Research Group did a poll using less euphemistic language, that it was about 45% of people supported this. So there's quite a lot of difference.
And there's a lot of misinformation. Again, if you're getting your information about this from mainstream media or other sources that either may be confused or advocating on their own, I think a lot of Americans haven't taken the time that you guys, and I applaud you again for coming out tonight to listen to this conversation. A lot of people really don't know what it's about.
You all seen the political campaigns. You know how brief political ads, 30-second political ads are, and how they touch on emotional messages such as Carrie Ann has identified. These are very difficult and expensive campaigns. We're just hopeful that we can keep this initiative off the ballot, but if it's on the ballot, we can raise the funds necessary to defeat it.
I'm going to change the topic just a little bit because I want to be able to speak about this powerfully. And one of the things that I have a little bit of a disconnect about is profit motives versus cost control. So we know that a lot of what goes on in healthcare is adopted first from Medicare and Medicaid and what the government requires. For instance, all the coding that we have in the insurance system today was all founded by the government requirements for those programs. And when I was listening to Ms. Lucas talk about this, it reminded me of Obama coming out during the Obamacare debates, saying, well, you know, rather than have the surgery, sometimes you need to just take the pain pill. So the Medicare and Medicaid, you know, programs right now, for instance, with Medicare, I get them mixed up, but I think it's Medicaid, where they're talking about that. The biggest bottom line number for that, or the biggest cost number, are joint replacements. So they're trying to find ways to avoid the joints. Okay, so you agree with that. So when I look at this, I want to be able to speak powerfully, and I understand that our insurance companies do have a profit motivation. But I'm just wondering if it's more powerful to speak about it from the fact that the government is pushing for cost controls because of limited tax dollars. Could you talk about that just a little bit?
It's certainly one of our concerns across the board. I mean, we see that. That's when I say it's easier to get a lethal prescription than a well-fitting wheelchair. A wheelchair like mine costs around $30,000, and a lethal prescription is a couple $1,000s. Without a good wheelchair, then people are stuck in bed. People end up with pressure sores, with bed sores. People can't work. You can't raise your family. You can't be involved in your community. All of those things lead to depression, which coerce people into asking for things like lethal prescriptions because they don't have choice. So do I think that the government's going to say, no, we're going to only cover this and not cover wheelchairs? No, but there's so many roadblocks in the way of getting good health care coverage, because whether it's private insurance or whether it's publicly funded insurance, ultimately cost containment is a big buzzword across the board. We hear this all the time in Medicaid, we hear this in Medicare, and you hear this with private insurance, cost containment, because when you start talking about people who are high utilizers, who are generally, that's a euphemism for people with severe disabilities, that's what you're talking about. So we are going to be coerced into these decisions, which is why we're so concerned about it. But it is across the board. It does not matter if it's private insurance or if it's public insurance. The two cases I talked about in Oregon are both Medicaid. The Oregon Health Plan, which is a Medicaid version in Oregon.
So Carrie Ann, would you say, to add on to that, then when you've got a profit-driven healthcare system coupled with cost containment by the government, you've got a double whammy there to be concerned about. So those two come together to really make this even a more urgent concern.
Ross Haas here. Two observations and a question. There was a case 10 years ago in Belgium where a young lady of 37 had her romance collapse. She went shopped around, finally got a doctor who said, "You've got autism," and that finished her. She was able to commit suicide under the system. The question, we're talking 101 or 100 and 124, which are initiatives. But I thought initiatives applied to statute law and amendments applied to the Constitution.
That would be correct, is my understanding, that these would be statutes. They would not be amendments to the Constitution.
Well, 100's an amendment.
It is, okay.
Yeah.
So you have a mix there.
Yeah, the distinction is that an initiative can be, there are two two measures, a referendum, which comes out of the legislature, or an
Right.
initiative, which comes from the citizens.
Right.
Either one can affect either a statute or the Constitution. Doesn't apply to one or the other. It could apply to both. One of these are constitutional, as I understand it, and
Correct.
one of these
100.
is legislative.
Correct.
100 is a constitutional provision, which is a very much more difficult thing, by the way, to change down the road if it
Right.
does get adopted. You look at legalization of marijuana, for example, in the Constitution, than a legislative measure.
And the other observation was that the German word for this is Leben unwürdiges Leben, life unworthy of life. And it's all one word. Thank you.
Hi, I'm wondering what the impact of these initiatives would be if reporting were required and how that would be a different effect. If reporting were required on the doctor-assisted suicide.
I think if reporting were required and true, actual reporting, I think it would be easier to uncover the number of stories of abuse and coercion and mistakes. We know of some in Oregon. For example, the case of Thomas Middleton, who was a gentleman with ALS. His caregiver got him to sign over got her named the executor of his will, got him to sign over his property to her, she was one of the people who helped him get the lethal prescription, help him take the lethal prescription. She was later prosecuted for essentially stealing his estate. His case is not reported in Oregon at all. So when the proponents say, oh, there's no reported instances of abuse, because there's no mechanism to do so, but we know the abuse is out there because we know of cases like Thomas Middleton. The very first case in Oregon was a woman who had advanced breast cancer but had a history of depression. Her doctor said, no, you don't qualify for this, referred her for a mental health evaluation. That person said, no, she doesn't qualify. She doctor shopped, which this bill actively encourages. She doctor shopped till she got to one of Compassion and Choice's doctors, who then gave her the lethal prescription. We know those things are happening. Better statistics would help uncover it, which would make it less palatable to the general public. They very much fight against the statistics because they really want this in the dark.
I'm sorry.
I'm sorry, go ahead.
Oh, I was just going to say, there's also kind of a closed community in these states where Compassion and Choices has a network of doctors that they refer people to. So it's not hard to find somebody who will do this. Sorry.
So my position is, irrespective of the transparency or lack thereof in the reporting of doctor-assisted death, I would still be opposed to it on public policy grounds. All human life, particularly human life of those who are elderly, infirm, disabled, and vulnerable among us, deserves to be protected and preserved, not destroyed.
Are there incentives given to physicians by the government or by healthcare insurers to encourage them, to encourage people to engage in doctor-assisted suicide? Should there be laws against that, or are there laws against that?
In theory, the measure, at least the Compassion and Choices measure, tries to address that. However, so there's not direct incentives. However, there are incentives to hospice providers, for example, to keep costs down. The reimbursement rates decrease the longer somebody remains in hospice care. So there's some disincentives that way in terms of prolonging life already. So we'll probably see that happen here, but nothing directly saying, oh, if you prescribe a lethal prescription, you get these bonuses. I wouldn't see that happen right away. I wouldn't rule it out down the road, but we wouldn't see that happen right away.
When you look at palliative care in Europe, in countries where this has been legalized, it is not a growing, thriving practice of palliative care. And again, this is anecdotal stories. I haven't been there, but I have heard and read of people who have said their family member was put into a hospice They go back to go visit and the bed's empty and they said, where's my family member? Oh, they decided they wanted euthanasia, so we euthanized them. So you have almost a sense of palliative care is not provided and people don't go for that kind of care in some communities because they're afraid they may be euthanized. We've got the government's own report in the Netherlands saying 7% of people who are dying there of actionable actions from a doctor have done so without their permission. So that in and of itself is a little frightening.
My question is, I'm going to direct it to Mike Norton, and it's based on the Thomas Middleton. And what you described is she obviously got all of the things signed over to her, and then she induced the drugs that killed Thomas Middleton. My question is, why wasn't she accused of murder instead of just stealing?
You know, I don't know enough about the facts of that case to be able to answer that question. Can you, Carrie Ann?
Because the death certificate is falsified to say that he died of ALS, his underlying disease, not the lethal prescription. So when you have a death certificate that does not say homicide, does not say suicide, there's no way to prosecute the death. And we'll see that happen here.
And I guess I would ask a little follow-up question. Was the information about the motive of the person who caused the death discovered some time after the fact of the death, or was it known at the time of the death?
It was a little bit after the fact of the death. I think there was several months that went by because it took her some time to get all the property transferred to her name before she was prosecuted for that piece. But the way these laws are written, it makes it impossible to prosecute somebody, and particularly in Colorado, it would be absolutely impossible because it grants blanket immunity to people who are at these deaths. So there's just no way. There's no way to build the case.
We see the same thing in the marijuana industry. You see the feds have, I mean, it's against the law, it's against federal law to traffic in marijuana, but they're just not enforcing the federal law here in the state of Colorado because of the problems with the legislation. Creates escape clauses.
What I'm wondering is, wouldn't there be statistics available and accountability by the cause of death registered on the death certificate?
No, because the cause of death is falsified to say the cause of death has to be, the bill says they have to put the cause of death being the underlying illness. So take somebody who has breast cancer, they have to say they die of breast cancer, not the lethal, not the suicide. And so there's no differentiation. I mean, there should be a differentiation between cause of death and manner of death. There isn't, and this requires them both to say the underlying illness. So it will not say suicide, which brings up another issue. Then you have issues with insurance, you have issues with will. And the other thing you can't do is we all might want to put a provision in our will saying if our loved one, if we die of assisted suicide, these people don't inherit, this is where my money goes, this bill, the bills before the legislature and Initiative 124 would invalidate those provisions of our own wills. So we could try to prevent that from happening to ourselves, and it would invalidate those provisions.
No, that's wrong. One more back here.
You talk about this as if it's not going on right now. But I had experience with an employee. We bought a health insurance policy that said generic drugs only, thinking that that's all we ever got. Then my employee, I wheeled her into the oncologist's office, and they told us, oh, you have generic drugs only? There are no generic cancer drugs. They treated her for 2 weeks, sent her to hospice, and she was gone in 30 days. That occurred here in Colorado.
And I frankly spoke at a symposium in Vail in January where a retired family physician admitted he had given lethal doses to people. He had euthanized people. It does happen. It's going to happen a lot more. And absolutely, insurance problems and the problems with accessing health care in this country cause untold people to die. This will make it worse. This will now give, and that's how people are coerced into doing this. So instead of trying to challenge an insurance company and try to fight for it, now they're going to say, oh, but we'll give you a lethal prescription. what choice do people have? It's not really a choice.